This is yours truly, Dr. Mohammad Ahmed Javed, US Canadian certified periodontist who's been working as a periodontist for the last 3 years. Came to Canada in 2011 and I have been here in Canada ever since. I am super grateful to each and every one of you who's watched the videos, had kind and nice words to say, asked for more content, encourage me. Allah Ta'ala aap sabka pala kare, taadi badi mehrbaani ji. Now, let's get to the point, shall we? I will inshallah make more videos regarding the topics that people have been asking for, especially like, dentistry. People from medicine, I was amazed. People from medicine were asking for more videos as well regarding medicine. And I told them, dude, yeah, भाईजान मेरी फील्ड नहीं है. वो कहने नहीं यार कोई बेसिक आइडिया तू बेसिक गाल चलते करो तो inshallah I'll try to make a video for people who are from medicine as well, hopefully inshallah. Luckily I had a little bit of experience because मेरे को बड़े जानने वाले करीबी मेरी फैमिली में हैं who went through the process, the medical process here in Canada, and I also, somebody who's really close to me is also going through this process as I speak. So I have a little bit of information. Inshallah, I'll share that information in the coming videos, but please take it with a pinch of salt because मैं expert नहीं हूँ. On a side note, I don't consider myself even an expert in the field of perio. I rather see myself as a student जो कि perio और implant surgery field का है. Anyhow, let's get to the point. I'll make more videos in the future regarding dentistry, so keep watching. One thing is, I wanted to set this thing straight. I just make videos for one reason. That's the intention. If I get anything else out of these, it's a jackpot, it's a bonus, but the intention is pure and simple. मैं कोई नेक आदमी नहीं हूँ. I just want to make sure that I do something for my सदका जारिया. That's it, simple. नेक नहीं हूँ मैं, बिल्कुल नहीं हूँ, लेकिन वीडियोस का पर्पस सिर्फ यही है. ठीक है, अल्लाह ताला की मेहरबानी. अल्लाह ताला has put me in a position where alhamdulillah अल्लाह ताला की मेहरबानी से I've been lucky to get dental education from 4 universities, out of which 3 are Canadian universities. And alhamdulillah, Allah Ta'ala ki meherbani, I've worked in a lot of clinics. I've worked in private practice. I've worked in the academia. I've done the research, alhamdulillah. I've published papers, alhamdulillah. I have pretty much, I give lectures. I've taught the residents. I've taught at the graduate level, undergrad. So Allah Ta'ala ki meherbani, I have quite a lot of experience, I think, in different facets of dentistry, which I think could be applicable to medicine as well. So inshallah, I will use that to share it for people who are up and coming, so that if they can benefit, to mere liye sadka jariya ho jayega inshallah. That's the sole purpose. More than that, if I get anything out of it, who knows, wo jackpot hai. That is not the intention. That's like icing on the cake. Okay, now let's get to the point. मैं आज यहाँ वैंकूवर आया हुआ था, and I saw a picture. And that reminded me of something. And I just thought, I'll share it with you. So, like I said, alhamdulillah, I've been lucky that I got dental education at 4 universities. And I also, alhamdulillah, Allah Ta'ala ki meherbani, I did the fellowship of the Royal College of Dentists of Canada, the highest, and also the diplomat of the American Board of Periodontists. So pretty much, in my field, these are the 2 highest qualifications in the world that as we speak. I don't care what anybody says. Probably, people are way more skilled, whatever. दुनिया में इनको ऐसे देखा जाता है. And why do I bring it up? मैं ये कभी बात ना कहता, अल्लाह ताला मुझे माफ़ करे, ये इसलिए नहीं है. I say that with humility, but there is a reason. कुछ तमहीद ज़रूरी थी उस बात के लिए जो मैं कहने जा रहा हूँ. So I was saying, I'm in Vancouver for a few days. I saw this. I saw this picture and I got a little emotional, actually. It's a picture of one of my teachers. Now, out of those 4 universities where I got my dental education, I was lucky that I have this one teacher. In my experience, when it comes to a clinical instructor, nobody is 70% of that person. That person is by far, hands down, the best clinical instructor ever. Period. Debate भी नहीं हो सकती इसके ऊपर. And on a side note, I would like to actually, it also reminds me that there are two more teachers. There are many, like, alhamdulillah, जब आप 4 यूनिवर्सिटियों में पढ़ते हैं तो बहुत से टीचर से पढ़ते हैं. Some of them, they are good, some of them, they are great, some of them, they are not so good, some of them, they are awesome, some are uber awesome. And then is this person that I'm going to talk about. His name is Dr. Ganad. Ghanad hai, Irani instructor hai, but everybody called him Dr. Ganad. So there are two brothers. I'm talking about the elder Ganad, Dr. Ganad, the awesome Dr. Ganad. And I saw the picture, I saw his picture, it was on one of the posters, and I got really emotional. And I thought, you know what? In our country, especially in Pakistan and India, we have a culture. We don't say nice things about people who do nice things. We don't encourage people. We don't say good stuff about people. We just bash people. We like to throw people under the bus all the time. And I thought, you know what? If I'm going to make videos, inshallah, about career and whatever, I will also make videos highlighting some of the great people that I've met in my life, the unsung heroes, one of which is Dr. Ginath. I'll give you a simple example and then I'll finish off, but I'll also name two of my teachers, two more teachers that I would like to really acknowledge actually. Anyhow, let's get to the point. Dr. Ginath. So I'll give you an example. I was the first year resident in periodontics at UBC. I was doing my first implant surgery. Now here in Canada at UBC, periodontics and implant surgery, all we did was pretty much surgeries. That's what we were doing. I was doing my first implant surgery. I was going to place an implant. I was going to place two implants. So let's take the example. Let's say this is the tooth. This is the crown part of the tooth. This is the root, okay? This is the last. So I was going to place tooth number 3, 6, and 3, 7. The idea is, let's just pretend this is the last tooth on the lower left side of the patient. Now I have to place two implants. I have to place an implant here and I have to place an implant behind it. The important thing is, in the ideal world, I would want to follow the root of this implant and I would want the root of this tooth, and I would want to place an implant parallel to this root, and then the next one would be parallel to the first implant. That's the basic idea. I was doing my first surgery, implant surgery. A final year resident is assisting me, and shout out to that final year resident. He's now in Toronto. God bless you, dude. You helped me. Super grateful. So I was placing the implant. The final year resident was there. He was supposed to help me and he did the best that he could. I was doing the implant. We take the first x-ray. Now my implant should be like this, okay? That was the angulation, perfect angulation. We take the x-ray and my implant is coming this way, which is not cool. If I was to go any further, maybe 2, 3, 4 millimeters, I would boom, hit the tooth. Not something you don't want to do, okay? I took the x-ray. The final year resident looks at me and I can see in his eyes that he's saying, "Oh, dude, you're done. You're doing a very stupid thing." And I got scared. I really got scared. I thought, okay, this is my first surgery. I am a screw up. I am done. I got scared. My final year resident says, "Mo, go and call Dr. Ganath. Tell him what you've done." So I go in there, I'm scared, and I say, "Sir, can you please come? I think my implant is not good, sir. Sir, please, sir." I was sweating, I was scared. He could see that. He says, "Oh, Mo, don't worry. Go sit, I'll be there." I go in there, I'm sitting and I'm perspiring and I'm thinking, okay, अब डॉक्टर के नाद आएंगे, बेड़ा गर्क होगा, बड़ी डांट पड़नी है आज और पता नहीं क्या बनेगा मेरा. He comes in, he looks at the x-ray and he says, "Voila, that is beautiful, Mo, good job, let me have a peek." Comes in, looks at the case and says, "Mo, you know what, looks beautiful, but dude, you know what, I'll tell you something that will make it even nicer. So let me show you a trick." Comes in, corrects the angulation and helps me while I was there, guides me, gives me the confidence to place the implant, stands there. I do my second implant, encouraging me throughout, saying nice things. Of course, the patient felt really good. And then Dr. Ganath just left. Once I had sutured everything up, everything was done properly. It was done really well. So I am done with the procedure. I'm done with the prescriptions. Everything is done now. Pretty much, I wait till all the residents are gone. Why? Because I'm afraid I will go and I'll talk with Dr. Ganath, and I'm pretty sure, he'll just throw me under the bus. So once everybody's gone, because I'm afraid, public mein bisti nahi karani cha raha tha. So I go and I meet Dr. Ganath, and as soon as I enter the room where he's sitting, I start, मैं अपनी लंबी गर्दान, sir, I'm really sorry. This was my first surgery. I'm really sorry. I screwed up. And he starts laughing. And he says, Mo, chill, relax. Tension nahi leni. It's okay. Everybody does it. And my job was to make sure that you do it safely for the patient and you do it properly. And we were able to achieve that. So chill. He did not shatter my confidence. He encouraged me. And I realized, man, that is some other level. That is just insanely awesome. So he was one guy who would always encourage, always. And he made sure when you were down and out that he would stand you up. He would give you the energy, the confidence that you can do it. It's doable. Don't worry about it. He would stand with you. He would help you achieve your target. So, and I remember when he left, I was still in first year, I think. He used to be the co-director, and then he left because he got really busy with the other stuff. And I cried. And I cried a lot when he left. And to this day, I have never had a clinical instructor 70% as good as Dr. Ganath. So I just wanted to make a video that sometimes, and you know why, another thing that happened, sorry I digress, but I was actually seeing a patient a couple of days ago, and after the consultation was over, I was leaving. The patient says, can I ask you a question? I say, yeah, sure. She says, do you have bad days? And I'm like, what do you mean? She says, you are so bubbly, so full of energy, so optimistic. How is that possible? See, you give so much positive energy. How can you have a bad day? And I say, you know what? I try to follow my role model when it comes to dentistry, when it comes to perio, when it comes to being a clinical instructor. My role model when it comes to being a clinical instructor or a clinician is Dr. Ganath. That's who I follow. So I would advise all people who are watching this video, in your respective fields, find somebody that you admire for their work ethic, somebody who's really empathetic, somebody who's really encouraging, somebody who's a leader in the truest sense. And who's a good leader? A leader doesn't create followers. A good leader creates leaders. वो encourage करता है, उठाता है लोगों को, गिराता नहीं है. जैसा पाकिस्तान में होता है ना, पाकिस्तान में तो कहते हैं जी ये आ रहा है मेरी फील्ड में आ रहा है, ये वो फ़र्क रहो. So, and like I said before I finish this off, I would like to actually name 2 other teachers as well, जिनका मैं अगर उनके पाँव धो के वो पानी भी पीऊँ तो मैं उनका देना नहीं दे सकता. मेरे 2 ऐसे और टीचर हैं. I would just like to name them. एक मेरे O लेवल के इंग्लिश के टीचर हैं सर हाफिज़ अकबर, अल्लाह उन्हें खुश रखे. और दूसरे मेरे A लेवल के केमिस्ट्री के टीचर हैं जो शायद अब दुनिया में नहीं है, अल्लाह ताला उन्हें जन्नतुल फिरदौस में जगह दे, सर नसीम भट्ट. बेहतरीन टीचर. इंशाल्लाह I'll make more videos. دس واز سم تھنگ آج جو یاد آئی اینڈ آئی جسٹ وانٹڈ ٹو شیئر ود ایوری بڈی. اللہ تعالیٰ آپ سب کو خوش رکھے، خیر سے رکھے. بہت شکریہ. تھینک یو. آریوس امیگوس.